to Health Facts with Normani Ricks. I am your host, Normani Ricks. I like to start off each episode with a little known health fact. Do you know what executive functioning skills are? Executive functioning skills act as the brain's air traffic control system. They help with planning, focusing, attention, managing emotions, and juggling tasks. I have the honor of having Dr. Sharifa Avery with us on the show today. Dr. Avery is a board certified internal medicine physician and the founder of Wellness with Dr. Avery. Her work centers around adult ADHD, metabolic health, weight management, and whole person primary care. Welcome to the show.
Yeah, thank you, Dr. Normani. Appreciate it. Thank you so much.
Tell us how long that you've been in operation.
Yeah, so I think this is year 11. Every time I think about it, and the years just add on. But yeah, basically 11 years in practice now. Graduated from medical school in 2015? Yeah. Yeah, board certified in internal medicine. You know, I dibbled and dabbled in the outpatient scene. I started in primary care, focused there, then, tried hospital medicine. Then this was a lot during the pandemic when I became an attending, and then virtual medicine. And now we have a whole virtual list, type of field as well. But, all those experiences kind of led me to my new practice, DPC. Yeah.
Okay. So I know you're very passionate about giving people the attention that they deserve. So
Mhm.
can you talk more about how that you're incorporate that into your practice?
Yes, and honestly, that was kind of the whole reason and motivation for me building my own direct primary care practice. Just some frustrations, that I had with working in the insurance traditional based model where, you're very limited in terms of, how much access you have to the patient, how much time you have with them. There's a lot of gatekeeping and bureaucracy, and it's challenging, and I just remember being a young attending, and patients would come in feeling frustrated, looking at me, and then I'm frustrated because I'm working for the same company that they're feeling frustrated about. And, I didn't understand much about DPC at the time, at least for me. I know it's been a while, it's been in practice for a while now. And of course, prior to that, concierge medicine was always a thing that was kind of only for the ultra wealthy, but I just learned more about direct primary care. I followed some accounts on social media that seemed really inspiring, and I just kept eyeing it because I wasn't exactly confident enough and felt ready enough to start something of my own. So I think I was still looking for the comfort of, working for a corporation, working just that safety net, when you work for another company that provides. And I know that's something common as you experience as a new attending with the imposter syndrome and the growth. But yeah, over time, I got more clear, more confident, more frustrated, and I decided to build my own, practice.
That's
Mhm.
awesome. That's something that we talk about a lot on the show about imposter syndrome.
Yeah.
So, how important do you think it is to have a mentor or somebody you can look up to that's already doing what you're doing? So, you mentioned direct primary care. Or
Mhm.
is there anybody that inspired you?
Yeah, so honestly, Dr. Christy Coleman, I know she has a huge following on social media, so I've been following her content for years. She's been truly aspirational, and she was probably, yeah, I think one of the first Black females I noticed to kind of take that step, at least for me, in my feed. But yeah, I was super inspired and I just watched her. And from there, I kept going. And then I just made sure, of course, through my whole journey, for me to get here, I had to, cling on to mentors because, it's just so much information, so much changes, medicine changes, jobs change, science shifts. And then, of course, as a Black woman, we are not in certain circles, or even invited to certain circles and networks. So you really have to kind of lean onto those pathways that were created for you, even if they're not as vast in a majority, and also create your own pathway, which is something like I'm noticing that I'm doing now as well.
That's awesome.
Yeah, yeah.
So I'm very inspired that you treat adults with ADHD. I'm an
Mhm.
occupational therapist and I get a lot of teenagers
Mhm.
and preteens
Mhm.
that their parents call me and they're like, oh, they have executive functioning issues, they have ADHD, they're making these certain grades in school. Can you help me? But how do adults with ADHD find you?
Yeah, so definitely right now how they're finding me is through social media, honestly, Threads and TikTok. But we have also established collaborations with therapists within the local community. A lot of psychologists and therapists have reached out to me personally too when they saw my brand, whether through the website or through the social media space. And just been staying in contact because I definitely want to make sure that I provide the needed resources for, adult patients who are recently diagnosed, and, needing that extra support in terms of behavioral therapy, executive functioning, all the things that encompass that, and even occupational therapy, definitely. Mhm. Yeah.
So your platform mentions evidence-based medicine.
Yeah.
So how do you explain that to just the layperson?
Yeah, so definitely, I enforce that definitely during the times of social media where I think they say in AI now, right, where they say, information is commoditized. So, anybody can access this. But unfortunately, there's a lot of misinformation out there. And I'm also, akin to that as I also, scroll Instagram here and there and threads. And then unfortunately, our I guess, what do we call it? Government also, has, made misinformation something that seems to be like acceptable. So it's a lot of us physicians who have been practicing for years, who, studied the research, studied the papers. And not only that, we just have the, groundwork, the clinical experience, we're with the patients day to day to day. And for anything, that's where a lot of my information, comes from, just, studying people. I love to study people. And then I apply that with, the science. And that I feel like is appropriate in order to kind of guide, individuals in personalized care and use appropriate, evidence-based medicine that has been shown to be proven. But again, tailoring that to the individual, right? Because even though it may be in the research papers, sometimes it always doesn't apply to that specific individual. And so we want to make sure we find the balance.
That is
Yeah.
so true.
Yeah.
So what does it look like,
Mhm.
for you to, I guess, screen a person with ADHD? Or what does, like, an evaluation look like, and what does the treatment look like for an adult?
Yeah, definitely. Yeah. So currently now, I want to say we're still in the beginning stages when it comes to psychiatry and just psychology in terms of actually implementing, the research and the information. Even just, discovering how ADHD manifests in women or in adulthood. A lot of the studies that we do look at, unfortunately, left out groups of people. And so when we recognize that, we are kind of, it's kind of challenging trying to figure out how ADHD or even depression or anxiety manifests in a particular group of, individual, in an individual, right? Based on how they were socialized. So historically, ADHD was studied in hyperactive little boys. And so that's why a lot of young girls or even women were kind of not diagnosed or misdiagnosed or labeled with anxiety. So now we're seeing, honestly, which has been the most destabilizing but also affirming part of medicine, is diagnosing a lot of these women that were not diagnosed, or improperly diagnosed, especially around the middle age, perimenopausal age, where symptoms are becoming more apparent, even though they may have done really well with masking prior to that. So because of the lack of standardization, we are just doing history and physicals. Not just, it's important, we do history and physicals, while some other providers may do like neuropsych testing or TOBA testing. While those things can be definitely informational and helpful, especially if the diagnosis is not clear, usually the history and physical tells you enough information, and lifelong symptoms too. Yeah. Yeah.
So the name of your practice is wellness. So I'm
Mhm.
assuming you're looking at the whole person. So
Yes.
what does that mean to you?
Yeah, that's just my standard of practice. It's how I live my life. I have my saying where, the symptoms are present in the body, but always a story. A lot of it is correlated to the mind, right? Things that happen in the mind present in the body, and it's interconnected. And I came about that more so when I struggled with my own bouts of like anxiety and being like diagnosed ADHD during the pandemic. And then also, a lot of my patients coming in with these diagnoses and recognizing, oh, their blood pressure is high or the cholesterol. And a lot of that is secondary to behavior or environment, right? And so, I feel like historically medicine and science kind of studied these things in separate silos, maybe because, it wasn't understood. Maybe some of it was incentivized, who knows? But definitely, the mind and body are interconnected. And if you want to treat the root cause of the disease, you have to understand the mind. Yeah. And that's essentially for me. Hmm.
How important is nutrition and sleep when it comes to mental health?
Yes, definitely. And that's part of the root cause that we treat. So, for my patients, oh, I'm so stressed out. My blood pressure is high. I need to go on a second pill. Okay. Has anybody taken the time to understand why you're so stressed out, which is causing your blood pressure to be uncontrolled and consistently high, or is causing you to maybe binge eat or emotionally eat salty foods that's also causing your blood pressure to be high. Has anybody understood that? Why are you struggling to sleep? Oh, because my thoughts are racing. Okay, well, has anybody ever evaluated you for why you have racing thoughts? Maybe that's secondary to ADHD. So maybe it's your undiagnosed ADHD causing those racing thoughts, causing that stress and anxiety, causing that pressure to be high. And to me, that's integrative medicine. And I feel like that's the way medicine was supposed to be practiced intentionally. If you have the time, unfortunately, we kind of missed that somewhere with insurance-based medicine or, the corporatization of medicine. Unfortunately, in that 15-minute window where you're meeting with your doctor, there is no time to address that. Yeah, and that's where DPC, Wellness with Dr. Avery, it's an integrative medicine practice where we have time to understand the root cause and integrate those systems because they don't happen in separate silos. Yeah.
Okay. So do you do in-person and virtual sessions?
Yep. So I offer both. I understand virtual is very convenient. And after the pandemic, it's been very hard to get people out of their homes and into offices. But luckily, with the kind of wave of co-working and things moving virtually, we have co-working medical spaces now, which are very interesting. So it allows for that hybrid schedule where your office is not picking up or taking on dust where you're at home, you use it as you need and you share it with other providers. And so I really like that aspect of it. Yeah. Mm-hmm.
So as an internal medicine doctor, do you have any advice on like what labs people should ask for?
Definitely. Yeah. So that's almost, the number one important thing when patients come to me and they're either complaining about specific mental health symptoms, even if they think it's ADHD, we usually start with asking, okay, well, when did you last see your doctor? When did you have a full set of labs? Because iron by itself plays a significant role in dopamine synthesis. And if the iron is low, so is your dopamine regulation. It dysregulate, your dopamine regulation is dysregulated. And if that's dysregulated, that can present and manifest like ADHD. I mean, we know iron being low or having anemia can be secondary, well, not secondary, but cause like anxiety symptoms. But
Yeah.
nobody ever looked at, the ADHD component as well. So iron, vitamin D, electrolytes, magnesium, these are all things that are really important in, improving and making sure that your mental health is stabilized. Yeah.
Okay, awesome. So, as a person that has struggled with iron deficiency my whole life, I have learned that it does cause like tachycardia, racing heart rate. And then I know because we don't get outside as much as we used to, a lot of people's vitamin D levels are low, which leads to like depression. And then as far as magnesium, I think magnesium has to do with sleep cycles.
Yeah, or more like relaxation. It
Okay.
plays a role in like constipation, anxiety, sleep, helps improve your sleep because anything that's really causing insomnia is secondary to your sympathetic nervous system being overactivated. So that stress that you feel during the day, oh yeah, that's coming to you at night. That's coming to you with the bed. Your nervous system is still there, and that causes insomnia and prevents your body from really resting and getting into that deep REM sleep. So sleep is
Okay.
a huge, huge important component. Yeah.
Okay, awesome. So your clinic is in Atlanta.
Mhm.
Is there a specific demographic that I guess seeks you out the most?
Yep. So far, it's been Black women, which I love because I understand, Black women, particularly in the health field, the medical field, as we know, often dismissed, ignored. Symptoms are not, taken seriously, pain not taken seriously. And I'm glad that these conversations are, being had. And it's being more understood. And I do see the companies, starting to acknowledge, cognitive bias and behavioral bias, because that is unfortunately something that's very real that, majority of humans do struggle with. But it is something that you can overcome. But I'm happy that I create this safe space for women that are able to come to me and just feel at peace and feel safe. And that is also something that's very inspiring and heartfelt and warming. Mm-hmm.
Awesome. Do you have any goals or aspirations to expand into other cities or states?
Oh, wow. I'm still trying to, stomach Atlanta. I mean, definitely, right now, my state licenses are in Georgia and South Carolina. So I'm seeing patients with my other practice that's a different company. And all over Georgia. So, definitely that's something that I am able to do in my DPC practice, my private practice. I definitely have a few patients in Savannah who are willing to drive, to Atlanta to see me because under state regulations and DA regulations, if I am going to see you for ADHD and prescribe controlled substance prescriptions, I do need to see you in person at least once a year. And so I like my patient to know that that is important if they do want to continue to see me, in Savannah.
Okay,
Yeah.
awesome, awesome,
Yeah.
awesome.
Mhm.
So, Dr. Avery, how can people find you and get in touch with you if they want to schedule an appointment with you?
Yeah, so right now they can go to my website. That's www.wellnesswithdravry.com. They can definitely book a consult. We have dedicated time slots in our day to book a consult, and you have the option of doing phone or video because I know some people can be phone shy. In case you need to get a little bit more comfortable with me, but of course, that first appointment will be video. Okay, I will need to see your face, and yeah, it's pretty seamless, and we go from there. Yeah.
Okay. Well, thank you so much for coming on the show today and sharing your knowledge.
Thank you. Thank you for having me. I enjoyed this. Thank you.
You're welcome.